The difference between what you hear a partial or a total knee replacement really just depends on which compartments we're replacing. People hear replacement, they think we're making like a huge bone cut and taking a lot of your bone out around your knee. A knee replacement is more like a resurfacing, which would probably be a better term for it, because what we're doing is we're essentially shaving off just the ends of the bone, about 9 mm slivers, and we're replacing that 9 mm with the thickness of a metal implant. Total and partial knee replacement are a little bit different. Everybody has 3 compartments in their knee, what's called the medial, or the inside of your knee, the lateral, the outside of your knee, and the patellofemoral, so underneath your kneecap and the groove that it runs in. Most people who have arthritis or cartilage loss in all 3 of the compartments. If that's the case, we do a total knee replacement. We shave off the ends of the bone or resurface the ends of the bone, and we replace them with metal and then a plastic liner. So your new surfaces are metal and plastic. That's a total knee replacement. A partial knee replacement would be somebody who comes into the office and has arthritis in only one of those compartments. So say the medial compartment, the inside of your knee, is bone on bone or the cartilage is lost. But the lateral compartment and the patellofemoral or the kneecap are totally fine, and they also have no symptoms in those areas. Then you may be a candidate for what's called a partial knee replacement, where we would only go in and replace that one compartment and not touch the rest of them. It's a little less invasive, it's a little easier to recover from, it's a little less painful, but the risk of it is you have to do it for the right patient, because remember, you're not touching the other compartments. So over time, they have a risk of those compartments also developing arthritis and down the road needing a conversion from a partial to a total, where now we've replaced all 3 compartments again. So you have to be very selective. I would say, honestly, the percentage of people who truly indicate for a partial knee replacement is usually less than 5 to 10%. If I have a patient that comes to see me and I think they may be a candidate for a partial replacement, they've got most of their arthritis in one compartment, they're not symptomatic in the other ones, I will always consent them for a partial versus a total, because to me, and in my training and fellowship, the true test is when you actually open up the knee during the surgery and you're actually able to look at the compartments with the naked eye. Because X-rays, CT scans, MRIs, none of them are 100% accurate. Some of them find things that aren't there, some of them don't find things that are there. So the best way to go about it is to lay your eyes on the actual knee right there in the OR. And if they have any wear in the other compartments that you didn't see on the X-ray, then we'll go forward with the total knee replacement. But if they don't have any wear or any cartilage loss in those 2 compartments, it's only the one, then we'll move forward with the partial that we plan for.